Good afternoon. Greetings of peace to you. Welcome to our health show here on Sure Council TV, Sure TV. We welcome you and we hope you're having a good week, a good start of the week, and hopefully everything's going good for you and your family, your colleagues, and everyone else. Today we're discussing Alzheimer's and dementia, which is something that affects a lot of the elder people and some middle-aged people as well, about 10% of the population. As they get older, they have symptoms and signs that happen, and you want to be aware of that. Other than that, in general, as always, with COVID, the vaccines are there. Please try to get them. Get yourself and your elderly parents, aunts, uncles, everyone you can vaccinated. There's many different facilities now that are offering them. The pharmacies, Rite Aid, CVS, Walgreens, they all have programs as well as your county programs. So please try to do that. And of course, mind the social distancing and wear your masks. It's very important to get ahead of this disease and look back at it and hopefully achieve herd immunity. That's very important, especially for our elderly population. Alzheimer's and dementia are something which we hear about a lot, and there's a lot of confusion about it. People don't really understand, is it Alzheimer's that they have, or is it dementia, or are they both specific diseases, or is one a disease or one's a syndrome? What is it? So we wanted to kind of shed light on that. With Alzheimer's, we've heard, I think they're telling us 10% of seniors, above 65, have this issue, and they get a diagnosis. So it's prevalent. So if you know a senior community, you have seniors in your life, it's something to look out for. The main thing, as we have a the slide over here. Alzheimer's is a type of dementia. So when you think of Alzheimer's and dementia, it's sort of like, lack of a better analogy, it's like you can say, Alzheimer's is a specific type and dementia is a general syndrome. And you could liken it to, for example, people get diagnosed with different cancers. Cancer being general, like a dementia, and then Alzheimer's being a specific type of cancer, a specific disease. So it's important to get that in mind. I know that, Alzheimer's is a specific disease, and it is the main cause, the largest cause of dementia is Alzheimer's. And Alzheimer's itself, if you look at the history, there was a doctor named Alzheimer's, and it's named after her. And she had a patient with the symptoms and signs. And then with dementia, it's a syndrome. Dementia, there's multiple types of dementia, so it's very important to know that, right? The causes of dementia, you could have nutritional causes, you could have Parkinsonian dementia, you could have frontotemporal dementia, you can have Lewy body dementia. You can have Alzheimer's dementia, you could have vascular dementia. So you could have dementia associated with depression and other mental conditions. So it's a general syndrome, and usually with dementia, the hallmarks as illustrated above are memory issues, specifically short-term memory, executive functions and reasoning and thinking skills. Usually with dementia, it's you notice that the individual is not able to take care of themselves, and they have a declining, daily, activities of daily living. It's declining. So those things you'll notice. And, one type of dementia is Alzheimer's dementia. Alzheimer's can cause that dementia. So that's very important to keep in mind. And with Alzheimer's, then, they have diagnosis criteria and factors which specifically show neuronal damage. You're actually losing brain cells in the brain. So there's the neurons that are damaged and they're decreasing. People with Alzheimer's have a shrunk brain, right? The brain is shrunken down because the neurons are decreasing. So there's literally, when they've done post-mortem studies on the brains of people with Alzheimer's, they notice that the mass of the brain has decreased. So that's another telltale sign. And then, of course, they look at, with imaging studies, they look at the plaques and the deposits in the neuronal system in the brain. So that's obvious with Alzheimer's. But so that's a little bit of the basic differences. But on a more a layman's term, we see people, for example, 60, 65, they say it's 10% for Alzheimer's. Another at 75, they say it's 20%. Another 10% increases. At 85, it jumps to 40%. So as the population is living longer and having longer longevity of life, you're more likely to see the diagnosis of Alzheimer's in this population. And it's important to recognize that. A lot of these sufferers, people who have this, are typically, there's nothing in early life that can point to it or indicate that you're going to get Alzheimer's. So there's no telltale signs or symptoms when you're younger in middle age. So it's important for us to maintain. There are some studies that have shown that people who maintain a good sleep pattern, a healthy Mediterranean diet. We'll talk about different diets next week, but a healthy Mediterranean diet with good fats prevents that neuronal loss in the brain. So it helps against Alzheimer's. It's very important. So there are those lifestyle changes. And then the number one thing is exercise. Exercise has been shown to decrease the incidence by 30 to 40% of Alzheimer's. So those people that exercise 3 or more times a week, at least 20 minutes, and you decrease your chances of getting Alzheimer's 30 to 40%. And also the other thing is to keep your, some people say, oh, do crossword puzzles and do things like this. It's important to keep your brain active. A lot of people say learning something new, something that takes cognitive function, so you're not cognitively impaired. It's important to have your brain do those exercises so that it can have those neuronal impulses continuously getting refreshed, and you're learning new things, and hopefully it's causing neurogenesis in your brain rather than the destruction of nerves. So those things are very important. Exercise, the Mediterranean diet, and doing things that challenge your brain, something new, something not that you're used to, something not the typical patterns and the games that you play, but something new, like maybe learning a new language. Some people like to go learn Spanish, learn Chinese, learn Arabic. These things keep the mind fresh and decrease the chances of getting Alzheimer's. With dementia, it's a little bit different because it's sort of a syndrome, and people have a collection of symptoms, and it's important to know that with dementia, you can reverse it based on the origin cause of it. So if it's something due to nutritional deficiencies, it could be drug interactions. A lot of our seniors are on different drugs. So you could have a drug-induced dementia, meaning that you might be on multiple medications and, you haven't checked them in a while, and, it might be dampening your cognitive function. All it takes is for you to sit down with your doctor and review your medications and make sure that these medications that you need to be on, and to take a fresh look. I mean, I think yearly, when you have your yearly visit with your doctor, you should definitely, advocate and review the medications to see if they're still necessary for you. A lot of people get in the routine of, oh, I'm on this high blood pressure medication, so I'm on it for life. That's not necessarily true. If you check your blood pressure and you've made some lifestyle changes, you've changed your diet, and you're eating better, you're exercising, your blood pressure, is bound to go down. So you might not need that high dose of medication. So those are the issues. Let's look at the clear differences here. Alzheimer's is one of the most common. It's very common in the elderly. It is a terminal disease. We don't have a cure for it. Okay, and there's supportive measures, of course, but it's a disease. Okay, that's clearly defined, and in old age, that's important. Dementia, you can get it anytime with different things. Number one cause of dementia in the elderly is Alzheimer's. And, again, some forms of dementia, as stated here, are temporary and reversible. And they can be, fought and, basically cured. And it's a collection of symptoms, with the short-term memory loss, confusion, and those things. So that's the basic difference that you should have in your mind. So when people say that, you should kind of clearly distinguish that. And again, the analogy was, you can say, dementia is, for example, a general, you could liken it to lung disease, and Alzheimer's would be a specific lung disease like asthma with specific symptoms. So that's basically the main differences. Now, it's important, again, to realize, what to do with someone that you feel has either dementia or Alzheimer's. It's important. You see a lot of seniors that might be, for example, you get out into a shopping center and you see someone and they're lost and they don't know where they are, or they've forgotten momentarily what they're doing. This could definitely be someone that needs help. And then the supporting cast, whether it's their offspring or they're at a nursing facility, they need to know what to do, right? Because this needs to be diagnosed and then treated. If it's Alzheimer's, there's one path for treatment, and if it's dementia, there's another, right? So it's important to recognize that. And in order to recognize that, you have to know the difference. The difference is very important to know. And if you're cognizant of the differences, then you can actually take care of your loved one or your colleague or a friend that's older in the proper way. Whether you get, usually, you go typically to the primary care doctor, and then they'll do a referral to the neurologist, and they'll do some testing and imaging, and they'll figure out, what the cause is. Sometimes if your family practice or internal medicine doctor, your primary care is available and on it, they can, in cases of dementia, figure out the root causes. But with Alzheimer's, you have to do the testing, you have to do the imaging, and then there's strict criteria that you can get a diagnosis for Alzheimer's. So that's important. And a lot of seniors in the community are facing this issue. A lot of, just a couple of days ago, there was a helicopter going around, and it was on a microphone, and they were looking for a senior because the senior had Alzheimer's, and he was walking around. He did not know where his house was. He had forgotten, and he was walking. It's very dangerous for our seniors to be in this situation, and that's because he wasn't diagnosed with it, and they did not know. But suddenly, he was out and about and lost, basically. So this can cause a lot of harm to our seniors, number one, and then number two, a lot of resources need to be set up and to take care of this problem. It's a diagnosis, it's a disease. There should be something that that can be done, which is beneficial for them, and it should be systematic. That's very important. So those are the main differences. Again, there are some newer medications and newer treatments that people try to administer in the mid 60s and 60-year-olds and early 60-year-olds. There are some studies now with what's known as regenerative medicine. There are universities that are doing some studies on the effect of stem cells on preventing neuronal loss, nerve damage in the brain. So there are some studies that are checking this hypothesis out, whether or not stem cells can actually help with brain health and help it prevent it from getting deteriorated or aging quickly. There's some anti-aging studies, and then there's some disease-specific studies with Alzheimer's at different university settings. So they're doing that. So you're looking to 5 to 7 years until those studies come through and they get the results, and they have protocols that can be replicated by the clinical side and clinical doctors, so they can allow those treatments. Other than those treatments, again, it's very important and to keep in mind that if you are a caretaker for a senior, or if you're a senior yourself, you need to make sure that you get some type of exercise on a weekly basis, at least 2 to 3 times. Even if it's just walking out in fresh air and taking a 30-minute or 20-minute walk, and even if that's the least you can do, that's awesome. If you can do that in a regular basis, that would be great, and that would prevent some of these symptoms and this neurodegeneration, as they call it. Walking, some people do because seniors are a little bit. You don't want to injure yourself, so there's a lot of what they use nowadays is the stretch bands. If you use the stretch bands, that can help you. You're just pulling and doing exercises based on pushing and pulling on those bands, and those bands are adjustable, so the tension is not too much, but your muscles and your joints still get that exercise. If you can get a couple bands and pull and push, maybe 10-15 minutes a day, that'll be great for your health. And then the other thing is, of course, sleep. As we get older, people decrease in their sleep. If you can get a good night's sleep and have a routine and follow it, and try not to, be on the blue light too much before you sleep. At least an hour before, or 30 minutes is the recommendation, that you shut off all the electronics before you sleep, so that you can actually go into a deep sleep. But if you're getting that light in your face before you sleep, then the sleep does not become deep. So that's important as well for brain health. And then, sleep, and then exercise, and then also the diet. Diet is very important. Again, we always, state this, let thy food be thy medicine. So it's very important, especially for brain health, to have those good fats. And if you look up the Mediterranean diet, and we'll discuss this next week, different diets and benefits of different types of diets and what they're good for. The Mediterranean diet is always touted for the good fats and good sustained energy during the day, so you don't have those cravings for sugary foods. But it's very good for brain health as well. Specifically, if you have a good pure olive oil that you utilize for your salads, and you nourish your body with that'll be definitely something beneficial for you. And these things, in effect, decrease the chances of getting Alzheimer's and cognitive decline by about 40%, 30 to 40%. That's what the literature tells us. These are things that you can do yourself. This is nothing that you need someone else to help you with. This is straightforward. Exercise, good sleep, good food, Mediterranean diet, and then also the fourth thing is challenge your brain. Again, if you challenge yourself with new things that you can teach your brain to do, Some people nowadays, get all these new apps and programs on the computer. You have to learn different things and get kind of savvy on it. If you can try and push yourself and get savvy on the computer and learn new things, that is the best thing for your brain. If you can learn a new language at any junction, that's very good for your brain and for the neuronal health. The neurons in your brain, neurogenesis and that firing of information across the nerves. That is something which the brain needs consistently to keep thriving and keep it from degeneration. So those are things to keep in mind to prevent these kind of things. And then also locally, if you do have a senior and you need help with them and they are, suffering from some type of dementia or Alzheimer's, you can always ask your primary care doctor to order home health. There are home health agencies that come and do exercises with the seniors, and it's paid for by Medicare. Medicare allots for this. They allow this because they want general good health. So you can always ask your primary care doctor to help out and assign, whether it's just like you can get home physical therapy, right? You can, if you have an injury to your body, especially nowadays because it's COVID, you can actually get, if you have Medicare, they can order for you home physical therapy where a physical therapist or a physical therapist's assistant comes to your place of dwelling and offers a program 2 to 3 times a week. So this is something which your insurance and which your Medicare should pay for, and they take care of that. And it's something which keeps you healthy, which in the long run saves them money as well. Because if you're healthy, you're doing well, you're not going to hospital for any reasons, they're saving money and you're healthy. So it's a win-win for everybody. So you can request from your primary care to, if you do have someone with Alzheimer's or dementia that you're taking care of, to order home health services so that they come in and go through different exercises with them. And they'll, even the physical therapy, they'll do it as exercise for you. And they'll do band training and different things to keep you active. It's very important. And then you don't want these, our beloved seniors to get into a depression because of lack of activity. So it's important to keep them engaged and keep them on a schedule and keep yourself on a schedule. If you're a senior yourself and you know that you have these benefits, why not utilize them? You can get the physical therapy, you can get home health. People come in and they help you out with different things, and it's part of your program. Specifically, if you're in a Medicare Advantage program, they have these programs where they come in and they do it all at your place. So please do take advantage of it, and that way you can have good overall health, and you can decrease the likelihood of Alzheimer's, and you can definitely make sure that you don't get dementia by keeping yourself fit, and you have your exercise, your good food intake, your good sleep, and you're learning something new, whether it's on the computer or some language or something. It's better than just watching passive TV. Watching passive TV has the same brain activity as when you're sleeping, so it's really not that great of a stimulus for your brain and for your neurons. So it's very important to keep yourself in an active and learning phase. Some seniors like to, if you're prone to literature, you can write poems, create things that take thinking. That's very important. Again, I mentioned learning a language, learning a new computer program, learning a new way to install something on your computer, learning how to navigate social media and get through different step-by-step processes. If you can do that, then your brain will remain healthy. And I think that's the goal, is the quality of life with everything. We want our seniors, as longevity is increasing, to have quality of life and have a good, and the young ones to support them in that. it's important that, if we're middle-aged and we have parents that are elderly, that we support them in that and keep them active. And you don't just put them to the side and say, well, they're seniors, leave them to be. You should try to keep their lives active and take care of them, and take care of yourself as well. It's very important. So that's basically it on Alzheimer's and dementia. We want to make sure we keep ourselves from getting in statistics like that. Well, 10%, 20%, and 40% at 85. So it was 10% for Alzheimer's at 65, 20% at 75, and then at 85 is 40%. But prevention is key. Prevention is key, and it's important. And if someone feels that they're losing short-term memory in terms of dementia, and you have cognitive issues, then you have to look for the source of it to see what it is. Is there some medication I'm taking? Is there something that I'm doing? Is there some environmental thing? Or is there some type of illness that I have that's causing this dementia? So you always have to discuss it with your primary care doctor and get to the bottom of it. It's very important. With that, we hope you have a good week, and we'll see you guys next week discussing different diet programs and their effects on your health. Tune in next week. Thank you for being here, and remember to mask up and wash your hands and social distance and get vaccinated, okay? Thank you and have a great day.